The electrocardiogram, or ECG, is a fundamental tool in modern medicine, providing a visual representation of the heart's electrical activity. It's a painless, non-invasive test that helps healthcare professionals diagnose a wide range of heart conditions. From detecting heart attacks to identifying rhythm abnormalities, the ECG plays a crucial role in patient care. Imagine the heart as a powerful pump, rhythmically contracting and relaxing to circulate blood throughout the body. Each heartbeat is triggered by an electrical impulse that originates in the heart's natural pacemaker, the sinoatrial node. This electrical signal spreads through the heart, causing the heart muscle to contract and pump blood. The ECG captures this electrical activity through electrodes placed on the skin. These electrodes detect the electrical signals, which are then amplified and recorded on a moving strip of paper or displayed on a monitor. The resulting ECG tracing provides a wealth of information about the heart's function. Understanding how to interpret an ECG is essential for healthcare professionals, particularly those working in emergency medicine, cardiology, and critical care. By quickly identifying abnormalities, clinicians can make timely diagnoses and initiate life-saving treatments. An ECG strip might seem like a jumble of waves and lines at first glance, but it's actually a highly organized representation of the heart's electrical activity. To decipher the code, we need to understand the basic components of an ECG waveform. The ECG tracing consists of a series of waves and segments that repeat with each heartbeat. The most prominent features are the P wave, the QRS complex, and the T wave. Each component represents a specific electrical event in the heart's cycle. The P wave represents the electrical activation of the atria, the heart's upper chambers. Think of it as the spark that initiates the heartbeat. The QRS complex, with its characteristic spike, corresponds to the depolarization of the ventricles, the heart's lower chambers. This is the most powerful part of the electrical signal, as it causes the ventricles to contract and pump blood to the body. Finally, the T wave represents the repolarization of the ventricles, a period of electrical recovery before the next heartbeat. In addition to these waves, the ECG also includes intervals and segments, such as the PR interval and the QT interval, which provide information about the timing and conduction of the electrical impulses. One of the most fundamental pieces of information we can glean from an ECG is the heart rate and rhythm. The heart rate, measured in beats per minute, tells us how fast or slow the heart is beating. To determine the heart rate, we use the big boxes on the ECG paper. Each large box represents 0.2 seconds. Count the large boxes between R waves and apply a simple formula to calculate the heart rate. A normal resting heart rate is between 60 and 100 beats per minute. Bradycardia is too slow, and tachycardia is too fast. Heart rhythm can be regular or irregular. Section 4. Electrical axis and intervals. Unveiling the heart's electrical activity. Beyond heart rate and rhythm, the ECG provides insights into the heart's electrical conduction system. The electrical axis refers to the direction of the electrical current as it travels through the heart. The normal electrical axis is slightly downward and to the left. Deviations in the electrical axis can indicate underlying heart conditions. For example, a left axis deviation might indicate left ventricular hypertrophy. A right axis deviation could suggest right ventricular hypertrophy or a pulmonary embolism. The intervals and segments on the ECG tracing provide information about the timing of electrical impulses. The PR interval represents the time it takes for the electrical impulse to travel from the atria to the ventricles. A prolonged PR interval could indicate a heart block. The QT interval represents the total time for the ventricles to depolarize and repolarize. A prolonged QT interval can increase the risk of life-threatening arrhythmias. Section 5. Spotting the red flags. Recognizing common ECG abnormalities.